At a time where healthcare is becoming more corporatized, more competitive, and more digital, perspective and positioning is what differentiates independent practices. If you want to lead in medicine, or like grassroots medical marketing, support those who do, you have to see what's happening beyond your own market. That's why I'm in Dubai attending the Global Knee Summit, a premier international gathering of orthopedic surgeons, innovators, and thought leaders shaping the future of knee care. On the surface, this is a highly technical, clinically focused conference, and it is. But for me, it's also something more strategic. International conferences offer more than education. They offer perspective. They show not only what is changing in medicine, but how it's changing across different healthcare systems, cultures, and patient expectations. For me, this is an opportunity to listen closely, observe carefully, and bring back insights that directly influence how independent medical practices grow, position themselves, and remain visible in an increasingly competitive healthcare environment. One of the most valuable aspects of this conference is how the panels are structured. These discussions aren't limited to a single country or healthcare system. The panelists come from all over the world, and the moderator regularly asks a simple but powerful question: how do you approach this in your country? That question changes the conversation. It opens the door to different techniques, philosophies, and constraints, and encourages thoughtful comparison. There isn't one universal approach to care or to marketing. And when you hear how experts across the globe manage the same challenges, patterns emerge. Trade-offs become clearer. Innovation stands out. And as someone who approaches this from a marketing and positioning perspective, I'm always listening for more than clinical content. When I'm in the room, I'm not just listening to what's being presented. I'm listening for how expertise is being communicated. How do leaders explain advanced procedures in a way that builds confidence? How does technology influence subspecialty positioning? What language resonates across cultures and healthcare systems? Where do outcomes, education, and access intersect with trust? These are the questions that shape effective, ethical, and sustainable medical marketing. Another reason I value these conferences, especially from a marketing perspective, is the conversations that happen outside of the sessions. The breakfasts, lunches, dinners, and social events. These casual conversations are often where the most honest insights surface. They give me the opportunity to ask physicians from different countries how marketing is handled where they practice. And no matter where they're from, I hear a very similar story. Doctors around the world understand the value of marketing. They just don't know where to start. These doctors are highly trained experts with limited time. They've gone through years, often decades of training, just like you. And the physicians who attend international conferences like this are typically leaders in the top of their profession, just like you. What they don't have is time, or let's be frank, the inclination to become fluent in the latest marketing strategies and tactics themselves. And they shouldn't have to. That's why I consistently encourage physicians to start by strengthening their foundation. A strong foundation is always the right place to start. Marketing doesn't need to be loud. It doesn't always need to be trendy. And it certainly doesn't need to be confusing. I'm grateful to be able to provide perspective, guidance, and clarity to help remove some of the noise that surrounds medical marketing. My role isn't to turn physicians into marketers. It's to ensure their expertise is seen online, understood, and trusted in a way that reflects the level of care they already provide. Independent physicians are doing extraordinary work every day. Too often, that expertise isn't clearly reflected online. What I bring back from conferences like this is clarity. clarity around how innovation can be positioned on practice websites, Google Business Profiles, educational and blog content, referral-facing messaging, and community and professional visibility. When marketing reflects where medicine is going, not where it's been, patients and referral partners understand value faster, trust builds sooner, and decisions follow. This is especially important for specialists offering advanced or differentiated approaches to care. If that story isn't clearly told and accurately told, Google doesn't understand it, and neither do their patients. Our clients don't have to attend international conferences to stay current on medical marketing communication. We do that for them. By participating in global physician-led conversations, we're able to strengthen positioning for specialists offering advanced or niche procedures. Align messaging with how patients and referral partners are actually searching. Create content that reflects leadership, credibility, and modern care. And support sustainable, long-term growth without sounding sales-driven. This is how we elevate visibility while staying grounded in clinical reality. Marketing should not exaggerate or oversimplify medicine. It should clarify it. When your online presence reflects your expertise, innovation, and leadership, the right patients find you. The right referral partners trust you. Growth becomes intentional, not accidental. Attending a conference like the Global Knee Summit is part of our commitment to staying deeply connected to the medical community we serve and translating insight into action for private practice physicians. I'm looking forward to using key takeaways from the summit for our doctors and continuing to ensure independent physicians grow practices that truly reflect the excellence of their work. And if you're a private practice physician looking for marketing that reflects your expertise, reduces confusion, and supports meaningful growth, we should talk. Cheers!